My name is Dr. Dalfi Wanda. I'm a clinical and radiation oncologist. I treat cancer using chemotherapy and radiotherapy. And today we're going to talk about bladder cancer. So, the bladder is a hollow organ at the lower aspect of the abdomen. Its function is to hold urine before micturition happens, before you pass urine out. So, the kidneys are the ones that filter blood, and then there are tubes connecting the kidneys to the bladder. So the bladder can hold urine, and then when instructions are given, it can release, empty the urine. So this bladder is lined by a special group of cells that are called urothelial cells. Those cells also line the tubes that connect the bladder to the kidneys and also the kidneys. The urothelial cells are the most common cells to get cancer in the body. The other cells, we have squamous cells within that system of the urinary system. And we also have adenocarcinoma that can happen, which is a type of cancer that happens from the cells that make mucous membranes that are secretory within that system. But the most common is urothelial carcinoma. So if you compare cancer of the kidney, that is urothelial, cancer of the ureters, and cancer of the bladder, then it is more common to have urothelial carcinoma of the bladder. So what are some of the signs to look out for? One of the signs is blood in urine. It could be bright red blood, or it might look like Coca-Cola, that is dark. And sometimes you don't realize there is blood because it's quite diluted with urine. So you would only know there is blood if a urine test is done that confirms there are red blood cells within it. Another symptom one can look out for is pain, lower abdominal pain, pain on urination, frequency, noticing you have to go to the washroom very often than normal, and also painful urination. When you urinate, you feel like there is pain as you urinate. Those are some of the symptoms to look out for. The most common is blood in urine that can be bright red or straw colored. So if you notice that there is blood in urine, whether there is pain or not, it is very important for you to go to hospital. Bladder cancer is more common in men, and most men don't like going to hospital. So if you notice blood in your urine and whether it is painful or not, kindly come to hospital. So what happens to the bladder to make those cells cancerous? So some of the cells that are lining the bladder can get what is called a mutation in the DNA. So every cell has DNA within it. DNA tells the cell what to do. It tells it grow. It tells it stop growing. It tells it die. It tells it, so it gives instruction. So when that center of command or center of instruction is damaged by a mutation, then there is abnormality in how the cell grows, abnormality in how it divides, and you find a mass or a group of abnormal cells that are formed, that are clustered together. That mass can bleed, which is why you can notice bleeding or blood in urine. That mass can cause the pain we're talking about that can be referred to the back. So some people, yes, the bladder is at the front, but they have back pain just because the nerves around that area can refer the pain to the back. So it's very important for us when you notice those symptoms to come early. When these tumors are noticed early, it is easy to treat. And sometimes all you need is surgery, and that's it. However, the longer you stay with symptoms, the more the treatment options you might need. You might need to do chemo, you might need to do radiation, and you might even need to have very extensive surgery because the tumor is extensive. So how we visualize the bladder, because it's a hollow organ. So when it's not with urine, it's collapsed. When it has urine, it's dilated. But the best way is to insert a camera and look at the bladder so that you can see the walls clearly. And if there's a mass, you can be able to see it clearly and even take a biopsy. Take a small piece and get to know what is this swelling that is in the bladder. So the procedure that does that, inserting a camera to see the bladder, is called cystoscopy. This is a procedure that is done by a urologist, inserting a camera to see the bladder. That procedure can be able to do other things other than just seeing if there's a mass. It can take a biopsy. If there's a bleeding vessel, there are times you can be able to sclerose and stop the bleeding. If you want to insert certain chemicals in the bladder, you can also do it in that setting. So cystoscopy is what helps us visualize the bladder inside. So many people would want to ask, what are the risk factors to having cancer? One of the biggest risk factors is cigarette smoking. So remember, the cigarette, we always say it has more than 1,000 cancer-causing agents. So with each puff, then you're introducing those harmful chemicals to the body, and they can affect many organs, the bladder included. And we have seen many cancer patients who have bladder cancer having history of smoked. And some of these harmful components, why the bladder is affected is because they are excreted through urine. So you puff, it enters your circulation, but how it comes out of your body is through the urine, and that way it poisons now the bladder, and in the process causing cancer to occur. Another risk factor is increasing age. So bladder cancer is one of the cancers we see in an older population, perhaps the age of 55 and above. So the older you are, the higher the risk. Another risk is being male. So if you're a male person, then that's a risk factor, because bladder cancer is more common in male than in women. And then there are certain chemicals that are harmful, that are known to cause cancer. And those chemicals include some dyes, rubber, textiles. So those working in the rubber industry, those working with dyes, there is a risk. So it's important to know what components are within the dye you're working with, so that if it's the ones that cause cancer of the bladder, then you need to have a lot of personal protective gear so that you're not exposed to them, so that there's no risk. And also paint products. So painters, those who paint, those who are working in the dye industry, maybe dyeing of leather, dyeing of clothes, there are certain chemicals that are harmful, and when taken through maybe inhalation, will be excreted through the bladder and cause toxicity of the bladder. So it's very important. That is why people who work in production, people who work in companies, it's very important to wear your personal protective equipment. There are times it's provided, but people over time just ignore. But you could be at risk of getting bladder cancer. If you have a chronic bladder inflammation, like all the time you're having a problem with your bladder, like a cystitis, an infection that's not going away, that chronic inflammation can be a risk factor to bladder cancer. There are other things that can cause that. There's a parasite called schistosomiasis. It's a mouthful. So when you have schistosomiasis, then it's a parasite that colonizes the bladder. So when the parasite is there is chronic inflammation of the bladder, and that can cause cells around that area to change and become cancerous. So it's important for you to know, if you're always having a cystitis, it's important for you to be treated well, to reduce the risk of you getting bladder cancer. Finally, is if there's been a family history of bladder cancer. So in most cancers, we say familial genetics play a role. And even here in bladder cancer, genetics play a role. So if there is family history of Lynch syndrome, there is family history of hereditary non-polyposis coli, colorectal cancer, then that's a risk factor. If there's been family history of another urinary cancer in somebody else, cancer of the colon, uterus, and other pelvic organs, then there is a risk of getting bladder cancer. So what can you do? One, don't smoke cigarettes, because we mentioned cigarette smoking as a risk factor. Two, when you're around chemicals, take precaution. Wear your personal protective equipment. If you're painting, wear a mask, because some of these chemicals are excreted through the bladder and are a risk factor. Then it's important for your diet to be rich in fruits and vegetables, because they have what is called antioxidant nature, which can help in case there are those mutations to be able to clear them from the body. So remember, what are the symptoms? Seeing blood in urine. It could be bright red or like Coca-Cola in color. Two, frequency, going to the washroom quite often. Back pain, that can also be another symptom that you can see that can tell you there is a challenge. Or even lower abdominal pain. We've talked about cystitis that's not resolving, inflammation. We've talked about schistosomiasis. So what you can do, avoid smoking, ensure parasitic infections like schistosomiasis are treated, and number three, ensure that your diet is rich in fruits and vegetables so that you can benefit from the antioxidant nature of that diet. Thank you.